the GERDEX procedure. A lot of us suffer with acid problems that comes back, and this is the one that actually helps how to prevent acid coming back into your food pipe. So this is a German-made product, and I just want to go through the various parts of this machine. So this is a hydraulic operated machine, and there are a couple of wheels there, and this is for the helix port, and you also have another port here which helps the scope, the tiny scope that's smaller than the pediatric scope that goes through 7 mm scope through this one, and there is another one here which actually deflates and inflates the stomach area. So that's we attach a normal blood pressure type cuff here to do that. Okay, so just to go through again, so this is a GERDEX anti-reflux procedure one, and it has open, close and firing, and then the different ones. So let's see how we're going to make a difference here. So I'm just going to ask him to, can you hold like this so that for the purpose of demonstration. So, and it works in hydraulic one. So this is the open one. So I want to close the arms there. So I'm going to do that. And then can you concentrate on this one for me? So just see that it brings the claws together. And I left it, stays there. Now I'm going to turn the all the way up. When you are actually in the stomach, you want to go up and then look back and then turn it 210 degrees. Let's see if I can able to do that. So all the way, I want to hold the position there, and I want to close that one. This is how you do it. Okay, so just to run through again. So I want that fixed position inside like that, and if I want to open the class there, for example, so it's a very interesting way how to, and then I'm using the open button there. So I'm in the position and it closed there. So to pull the geojunction back into position for the hiatus hernia, we pass the helix through. So, and I want to close this again. So just pull it up, put it there, close there, and I want to bring it back to the situation. So open situation, go back again. So run through again. So these are the wheel controls. This is the helix control, and this is the hydraulic one, which we use it either to open or close. So that's the closest position. I want to bring it open position, okay, and then whatever things we want to do. And this is the endoscopy that comes through this port here. So what are the other parts of this one is actually a guide wire. Can I have the guide wire please? And the helix. You all know that the helix part is the little spring-like thing here, which actually squeezes into the tissue when you actually rotate it around when it comes this way. Okay, how do we feed it through? So that's an important question. So we feed it actually through this part. Can you focus on there for me? And somebody help me to hold this. So where does this one come through? It should come through this one here. So let's feed it through. Can you feed it through all the way up for me? Yeah, come back. So feeding. Yeah, just keep feeding. Keep feeding. Keep feeding. Keep feeding. Keep feeding. Keep feeding. So I expect that to come through this. Keep feeding. Should come through this.
Came.
Yeah. So once it comes through, I want to maintain the position just in line there. When I'm actually in the tissue, I push it forward, yeah, and then yeah. So you see that the little thing comes out. The helix actually is spring-like thing that comes out into the tissue. Like for example, if I have to go through, can you hold like this for me? Just to show them that, yeah, pull this one backwards. I'm not going to fire on you. See that? It's pulling the tissue. And then I pull it into the claws. Can you release gently? So it comes into the claw like that. Okay? Can you see that? That's what it does. Thank you. and then the other thing is just release it from there. You do the opposite turn, comes back. That's what it is. And the other important thing that we have is a guide wire. So when we do a normal gastroscopy, so it has two floppy ends. Both of them doesn't do any damage to the lining if you inadvertently pushes anything. So the way it works, hold on. So basically, we push it through this. So we already did an endoscopy and put the guide wire through. This is hanging outside. Before we actually put it through, we just want to get this one through. It comes through the, yes, here, right, here we are. It comes through this one, for example. So it comes there, and then what we do is we have to go